Hey there. Ever wonder what a chiropractor actually does? Maybe you've heard a crack and thought, is that it? Well, there's a lot more to it, and today we're breaking it all down. I'm Dr. Lucas with MyChiro, and I'm here to walk you through what chiropractic care is, what to expect, and how it might just change the way you feel naturally. So let's dive in. So what exactly is chiropractic care? It's a natural, drug-free healthcare approach focused on the spine, joints, and nervous system. When your spine is moving properly, your brain and body can communicate better, and that helps you feel and function at your best. Think of it like fine-tuning your body's movement system without surgery or medication. Now, chiropractors don't just crack necks and backs. Here's what we actually do. We assess and diagnose issues with your spine, joints, and muscles. Perform adjustments by hand or with tools. We offer stretching, strengthening, and posture advice. We use techniques to reduce pain, tension, and improve mobility. In a way, we're movement specialists who help restore proper function to your body. Chiropractic care can help with way more than just back pain. We commonly see patients for neck pain and tension, sciatica, headaches and migraines, poor posture, joint pain in the shoulders, knees, and hips, ribs, pregnancy discomfort, and sports recovery. If it moves and it hurts, we're probably able to help. First visit is all about you. Here's what usually happens. 1, there's a consultation. We talk through your symptoms, lifestyle, and goals. Number 2, we do the physical exam, checking posture, range of motion, and maybe a few orthopedic tests. And occasionally we'll take x-rays if we want some deeper insight. And then typically the first adjustment, if it's safe and appropriate. You might get your first treatment that day, which is what I do. Start out 3 visits per week for 2 weeks. We do a reevaluation at visit 6 or at 2 weeks, whichever comes first. And if you're improving in that time, we reduce the care or dismiss. Or if it's not getting better in a week or 2, then we refer out or get some imaging. But even with that, some people are just 1 session and they feel great. That's a lot of my patients. Chiropractors aren't real doctors. And that's not true. We're licensed professionals with years of education and training. Adjustments are dangerous. Chiropractic care is one of the safest drug-free therapies out there. There's a reason our malpractice insurance is really cheap. Once you start, you have to go to a chiropractor forever. Only if you want to. My goal is to help you get better, not keep you coming back forever. So why do people keep coming back? Honestly, because it works. The benefits include pain relief, better posture, improved flexibility and range of motion, less tension and stress, better sleep, faster recovery from injuries. It's not just about fixing pain, it's about keeping your body moving well. You should see a chiropractor. You don't have to be an athlete to benefit from care. Chiropractic care is great for desk workers with neck pain and back pain, athletes managing injuries, pregnant individuals with lower back tension, seniors wanting to stay mobile, really anyone looking for natural wellness support. So now you know, chiropractors do a lot more than just crack joints. We help you move better, feel better, and live better. If you're in Sioux Falls and looking for convenient, personalized chiropractic care, MyChiro comes right to your door. Book your house call online, and let's get you back on track. Like this video if you learned something new, subscribe for more wellness tips, drop a comment if you've tried chiropractic care.